So basically, it is Imperial Dental Specialist Center, and we have started our journey in this infrastructure since back to 2013. And we have total of 3 floors. So first ground floor and the first floor is for mainly treatment purpose, and we have one auditorium as well for our internal and external training as well, and we have our office room. So currently what you are seeing, that is basically our first lounge in the lobby for the patients who are waiting for the treatment, as well as who are actually just completed the treatment and they are waiting to make the payment and as well to collect their medications. So over here you can see this is our customer service desk. And this is Miss Jessica, one
Hello.
of the customer service executive, and this is Dr. Ben, who's
Hi,
actually
Dr.
one of
Ben.
our dental
How are you?
officer as well. So this is one of the counter that we have for the registrations, as well as that we're dispensing the medications and collecting the payment. Typically, we actually have few more lounge as well. One of our aim is that when patient completed their treatment, we do not want them to wait longer time to get their medications as well as to collect the payment. So our target is within 3 minutes, we want to actually complete this whole procedure. So that's why this particular lounge we want to dedicate it for those who have completed the treatment, just waiting to collect their medications and to make the payment. Okay.
So it needs only just 3 minutes to...
Yeah, around 3 to 5 minutes actually.
3 to 5 minutes, okay. It's wonderful. They need not to wait for a long time.
Because you know that when the patient actually completed the treatments, they may have some other things to do. So we just want to make sure that actually you're just not waiting or wasting their time. They just know that what is the purpose they are waiting. So just complete that purpose, dispensing the medication without the medication.
It's wonderful.
And in case some of the patient may require some follow-up appointment, most of the time actually the follow-up appointment has been already made in the treatment room, because we want to ensure that respective doctor or the dental assistant who has attended the patient, they knows what is the next procedure. So we want to ensure that the appointment has been booked over there. But in case that somehow missed it, therefore, we also ensure at the counter that when is the patient's next follow-up appointment.
Okay.
So maybe we can move over there. So now I have
Is this the decorations for the Christmas?
Yes, this is for the Christmas. So basically, you know that in Malaysia, that actually we have Christmas, we have Chinese New Year, we have Deepavali, also we have Vesak Day, some of the major, and Hari Raya and Hari Raya Haji, which is called Eid al-Fitr and Eid al-Adha. So since our patient is from different countries as well as the local patient, so we want to actually make them feel a little bit to appreciate the celebration as well. We want to celebrate with them. So this is particularly for the Christmas celebration. So you know that Christmas is just coming in December. And so also wants to share about that our experience zone. So basically, we are one of the implant as well as the orthodontic center. Our chief consultant, Dr. Howie, is actually practicing orthodontics for over 30 years. So since you know that orthodontics treatments from the conventional method, it's moving towards to clear aligners. And so we are actually making this an experience zone, our patients, so they can actually feel how the aligners looks like. Is it comfortable or not? What is the weight? Because some patients have some curiosity as well. And just to let you know that actually Imperial Dental Specialist Center is one of the Invisalign diamond provider since 2015. So we actually almost completed 1 decade as a diamond provider, one of the diamond provider in Malaysia. Okay, so now we move on to the treatment rooms as well. So in ground floor, we have total of 4 treatment rooms, and you can see this is it's a Singapore, and next to you it's Seoul. I can share with you what is the reason that actually put the
It's interesting. Seoul, Singapore.
Okay, so if I'm not going to be I'm wrong if I share that around 40% of our patient is coming from overseas. So and also Dr. Howe actually has over the period he do some international lectures as well, almost every month. So therefore we want to, when the patient's coming, we want to let them feel something symbolic they can remember, okay, this is my city, this is my country. Okay,
interesting.
so that's the reason that actually we put all the treatment rooms as
to make them more comfortable, like
more comfortable. Actually, that there is some sign of their country, okay, and we are recognizing them as well. So let's move to the Singapore room. So this particular room has been used by Dr. David Tan, who is one of our senior registrar. So this room, as I mentioned, that Imperial Dental has been actually in this infrastructure since 2013, so it's nearly 12 years plus. So at this moment, currently this month and upcoming months, we are actually changing all of our dental chairs because it's over 12 years plus. So this is one of the dental chairs just has been installed recently. It's fully functioning. Next door also the dental chairs actually has been replaced, just we are waiting to fully functioning this time. And also, since you will see that these particular rooms also have one intraoral scanner. So in Imperial Dental we have total 4 intraoral scanner because we actually no longer practicing conventional impression. We are taking all the digital impression for orthodontics treatment, full mouth rehab, crown, veneers as well. So let's move to the sole room as well. So as I mentioned that we are still installing the new dental chairs, so it's not ready to practice or use yet. Since Dr. David is using 2 rooms, so he's currently using the Singapore room.
Okay.
So let's move to
Let's move on to
so,
side.
These are the tools actually for the patients or our guests to use as a washroom. So here is for women and men.
There are some certifications in the wall, so people can walk through the corridor. They can see the certifications.
Yes.
It's a wonderful idea.
Okay, so beside this, we have one VIP room as well because, as I mentioned, that some of our patients coming from the overseas, so that they're actually taking a long flight. Sometimes they're actually waiting for their appointments. So instead of waiting their hotels or some other places, actually this is a comfortable place. They can sit, they can have their coffee or drinks or light snacks as well while they're waiting for their appointment. Okay, so this particular room is dedicatedly made for those patients that are waiting for the treatments, as well as sometimes we have some guests as well to discuss, so we can arrange this room or use this room for that discussion at the meeting as well. So over there you can see this is Phnom Penh. And okay, so if we move here, these are the 2 rooms. One is Phnom Penh and Tokyo, used by Dr. Alice, one of our senior registrar. And as I mentioned that we have total 4 intraoral scanners. So you can see this is iTero scanner as well. So Dr. Alice to use it. This is Tokyo. So the more or less actually the room infrastructure is same. Okay.
It's very cozy and it's well equipped, I think.
Yes, you're right.
And all the I think the little devices, maybe they are placed in the cabinet.
Yes, you're right. So it means the instruments is actually put inside the cabinets as well. And all the rooms are actually well equipped. So basically that sometimes that some of the practice you will see that one particular room is actually dedicated for particular treatment, like this is only for surgery, this is for ortho. Basically all of our treatment rooms is well equipped for all kinds of treatment. But yes, it's still sometimes, let's say doctor doing some major surgeries, they have some preference as well, okay, I want to use this room, but all the treatment rooms actually well equipped for all kinds of treatment.
So most of the time you need not to carry equipments from one room to another.
Not necessary. Yep. As I mentioned that you can see that one of the scanner actually is using for these 2 rooms, which is Dr. Alice, and another scanner you just noticed in Dr. David's room, so they actually don't have to move it from here and there. Okay, so this is just now I was talking about that we have another lounge in the lobby for the patient actually who is waiting for the treatment, because you know that first at the first lobby there's not much space, so this is the patient that actually wants to sit and this is more comfortable as well. They can actually sit here, they can enjoy tea and coffee while they're waiting for their appointment.
Waiting room is different from the billing room. So
Exactly. You're right.
it's wonderful.
And also, sometimes some of the patients actually come with the accompany as well. So since this is a place that enough space, they can actually sit over there into the accompanies. While we are here, that I actually wants to share some of our certification and crest that when Dr. Howe visited some of the countries and some of the conferences as a lecture, so you can see over there.
So many hours and crest and certifications.
So you can see that our Invisalign providers as well, Dr. Alice and Dr. David are also a certified Invisalign provider, including Dr. Howe.
It's wonderful.
So initially, when Imperial Dental, before we named as Imperial Dental, when Dr. Howe was individually practicing, it was named as a House Orthodontics and Dental Surgery. And then after that, we have changed as practice name as Imperial Dental Specialist Center since 2013.
Okay. So you have 2 more floors.
Yes, we have 2.
Also, you have a training session, training room for training sessions. So can you visit that?
Yeah, sure. We can move to the first floor right now, since I have mentioned that here we have 4 dental treatment rooms, particularly for Dr. Alice as well as Dr. David to use. So, yeah.
So you have elevator inside the clinic.
Inside the clinic is our own elevator. Yes. So basically, since we have to utilize and efficiently the both, space and area, so we can open the door from the both sides.
Both sides.
So entrance is this, and the exit. So we have few treatment rooms as well. And let me introduce. This is Miss Aisha, which is our clinic manager.
Nice meeting you.
Hey, nice meeting you too. And I'm with
This is Dr. Atik Mehdi.
Dr. Atik.
Yeah.
Hi, okay, Dr. Atik. I will take it from Mr. Hussain here. So I'll bring you to tour around the first floor.
Okay.
Yeah. So
Nice.
Dr. Atik, let's Aisha to move around to get a tour. Okay, Aisha, please.
Alright, okay, so for today I'm going to bring you guys around the first floor of our clinic. So in here we have the Sydney room. So the Sydney room here is one of the bigger room. We only have 3 bigger room in the first floor. So the Sydney room here looks empty, but well, it's not empty. So usually we do some major treatments here depending on if, let's say, our London, which is what I'm going to show you later, our MOS room is available or not, and also Paris, which is our implant room. So let's say if this 2 room is occupied and we have more than 2 major operations at the same time, it's going to be held in Sydney. Okay?
Okay.
So other than that, we also have the other bigger room, but this room in specific is out of service for today. But this room is for our
Kids.
pediatric
Oh,
patient.
wow.
Yes. So if you notice, this whole room is very colorful. It's pink in color, and there's a lot of animation in this. And also we have a TV
Wow.
on the upper side here. So it's to keep all of our pediatric patients occupied all the time. But if, let's say, we do not have any pediatric patient, this is also a fully functioning room for our adult
Adults.
patients. Yes.
Okay.
So in here we just have our waiting area, and then on this side is just our internal team area for debriefing and other stuff. So this is just the sterilization unit, and also this is our staff's locker room and staff's toilet. Going up the ramp here.
So
We
you're going to
have-
London.
Yes, we are heading to London, and we have our 2 guest toilet in here. And then
It seems like it's a world tour.
Yes. So this is our main operation room. So actually we just changed this chair recently. So it is still in installation. So it is still pretty new. So there is a lot of things that have not been unpacked here. But this is a fully functioning operation room. So that which is why we have so much lights in here. We have about 3 lights in total in here.
Mhm.
So this is just to make sure that we have everything on hand in the same room, so our assistants doesn't need to run from room to room.
Mhm.
So this room are also occupied with all of
Laser.
our equipment, so
Mhm.
lasers. This is one of the machine that we put in here for the time being.
Whitening,
This
it is
our
mainly
whitening
used
machine.
for.
Yes, that's right. And then after that, all of our emergency equipment is also here,
Mhm.
and our first aid is also here. So we also have our fridge and also some of our
Sterilized instruments.
instrument in here. That's right. So because we are a specialist center, so most of the time, because we work with a lot of clear aligners and other orthodontic cases, we do have these smaller rooms like Holland, Geneva, and Bali for us to occupy the weekly review patients.
Okay.
So our patients usually come every 6 to 8 weeks. So every single weekend, usually we have fully occupied rooms because most of our patients are young patients, so they only come when they are like off from school.
Mhm.
Okay. So here we have our X-ray room. So definitely we have our 3D imaging room,
Mhm.
our IOPA. So this 3D imaging machine actually also not only CBCT, OPG, lateral cephalo, and also PA style, even IOPA. So this one also managed to take a full jaw CT, so even a full style CT. Okay. So again, a smaller room, and we are looking at our implant room. So this is our implant room. Again, Paris is also like London, a fully occupied operation room. So in here we have more equipment for implant. So in this room here, we have more like implant machines. So we have multiple implant handpiece machines in here. From multiple brands actually, because we have worked with multiple brands before. We have worked with Straumann, Dentium, Dentist, and multiple other brands. So for the time being, we are focusing on Medigen and also Bioconcept, but we also work with other implant brands, but then granted it was informed to us that we can work with it lah. We do still need to order all of these other brands. Okay, so most of it are here. This is also collections of implants that we have lah. So plasma activation machine, and yeah, so all of these cabinets are also full of implant materials. So yeah, this is where all the magics happen with implants.
It's wonderful.
Yes, so that is all for our first floor, I think. So what do you think, Dr. Atik?
Yeah, it's wonderful. It's very organized, and I'm just amazed with the names of the clinics. That is
Imperial's name from Dr. House Orthodontic to Imperial. The concept itself is the globalization. Yeah, which is why actually most of our patient pool are not only from Malaysia but also from all over the world. So usually our patient pool is about 60% foreigners. Yeah, so most of them even comes all the way from Europe and US just to get the treatment done here. So most of the time it is for major treatment like a full mouth rehabilitation or even an orthodontics treatment.
Though they are traveling a long way to get treatment, but they will feel at home when they will enter in their own country named room. So it's wonderful.
Yeah, well, sometimes they are also amazed about it. So, when you are bringing them inside, like, oh, I'm going to my own country then. Yes, you did. You are, but for a better price point. Better price point, but maybe the same or even better quality then. Dr. Atik, this is our auditorium on the second floor. So this is where the internal and the external training happens. So most of the time we hold an internal training about twice a month. Sometimes we try to increase the frequency depending on the intensity of the patient also. So the more the patient volume, there will be more things to learn and more internal trainings that needs to be done. And also for our management team, usually we have a meeting every single Monday of the month. So I'm sorry, every single Monday of the week. So that's usually also where here is also where we have all of the meetings, and also our external trainings. So as I mentioned, we also provide aligners. We also provide metal braces. We also provide implants. And for clear aligners, we provide more than one brand. We provide 3 brands at the current moment. For implants, 2 brands. So all of this company, they come here, they bring their clinical specialists to give us an introduction to their products, to give us the introduction and also to walk through with us the principle of their system, of their software, just for us to be so familiarized with their products so that we can also help them with their marketing. So that's where it happens.
How many participants can sit in a single seminar?
This particular room can hold up to 30 to 35 packs.
30 to 35. That's wonderful.
Yeah.
Wonderful.
It's not so big, but enough for our small team.
It's very cozy and comfortable for the participants.
Yeah. It does have a full-fledged AV system in here. So if you can see here, we do have like a projector in here, and also we have a full screen
And the monitor also.
Screen and also monitor, and also the
Sound
audio
system.
Yes, correct. So so if there is anything that needs to be done here, can be done here. It's just the capacity is a bit limited. Yes.